This is Doctor Patient, a podcast that examines all the aspects of the patient-provider relationship. I'm your host, Heather Johnston, MD, a real-life doctor and patient. The last episode of Season 1 was called How We Learn to Be a Patient, in which I interviewed my own daughter about her first experience going to the doctor's office without a parent. And the result was a hot mess, which we were able to laugh about a lot in that episode. If you haven't heard it yet, I'll recommend you pause here and listen to that mini 12-minute episode first, then come back here for this follow-up. What stuck in my mind after she and I recorded was how little a kid of a doctor knew about how things work in an outpatient office. Granted, the folks at the place where she went to for that episode weren't the best and were asking her things like, "Would you like a strep test today?" Of course, doctors should not be asking their patients what to do. And she was getting flustered because how was she supposed to know that? What I realized is that I simply haven't prepared my kids very much to enter today's insane medical system. So I set out on a mission to better understand where other young adults are with this, and I talked to 6 more, all in their young 20s, most in college. What I discovered was that while of course there are variances in their experiences, there were definitely some common themes. First, everyone is confused about health insurance. In this way, they are now truly and officially adults. Second, a lot of them are operating on a need-to-know basis and are following the plan of, if it's not killing me, it will probably be okay for me to avoid going to see a doctor. Third, and this one surprised me, most of them actually care about trusting their doctor and wanted good communication from a doctor's office. I honestly thought that most of them would tell me that they would choose ease and convenience over trust, but my assumption was wrong. Lastly, it sounds like most parents aren't trying to teach their kids about the healthcare system. Zero judgment here, as I am clearly also one of those parents, but I'm thinking this should change. The system is too complex and difficult for someone to enter adulthood without knowing the basics of how it works and how to advocate for themselves. Listen to the end of this episode to hear about a Healthcare 101 curriculum I'll be piloting with my own kids this summer. Okay, first up, I asked Barrett from Chicago how it was the first time going to an appointment without her mom, who usually had been the one to go with her.
So sometimes during high school and college, I literally didn't have access to be with her or ask her questions all the time. So she kind of just assumed that I knew these things, and I'd go in and they'd ask me all these questions, and I'd be like, I really don't know that.
Did you feel like they were acknowledging and helpful to you in that you were a new patient?
They were, but it definitely was also I think hard for them because there was questions they were asking, oh, what's your family history, and there's no way they can coach me or help me on that. So they weren't annoyed or anything, but they definitely were okay, well, if you don't know, I don't know what to tell you. So they were definitely helpful, but there was definitely questions where they're just well, if you don't know this, that they can't really help you with certain things, or we can't help you with that question.
Yeah, totally. So do you remember one of the first times where you went and you felt confused or unsure?
Yeah, definitely. I think I've had health problems throughout all my life, so I don't even remember at this point what I was going in for. But I do remember that they would ask me, what are you taking? And I'm only on one medication usually, but supplement wise, I'm on a ton of different things to help equalize my body. And I could remember most of the names, but then they started asking oh, what's your dosage? And I was like, oh, that I have no idea. So when it came to things dosages of my medicines and supplements, everything, they were how do you not know how much of an actual because I'm on a steroid for my lungs. I know what the name of it is, but I don't know what the dosage is. And I was I think I'm on the 20 milligrams. They're you don't know. And I'm no. So, yeah.
See, I think that's actually very normal. And normal is a terrible word. I think that's probably very common that many young adults don't know dosages of their medication or probably even the name of them if they're on them.
Yeah, that's true. It's just very
Yeah.
stressful at that moment because like also my mom's so organized with things. So it was like I was just like, am I supposed to know these things? Like it was just weird. I was just like, am I supposed to be as organized as my mom with this? And it just got really confusing and turned into like a whole thing where I'm like, what am I supposed to know?
So do you feel like at this point now that you've had a few visits, are you pretty comfortable getting through them
I'm
in that way?
definitely more comfortable with them. I definitely probably would need to write like if I need to know my dosages, I'd probably still have to write them down. I still don't like know them by heart as much as my mom does. But I definitely know what to expect now and definitely can do them with more confidence because like now I am able to go and like get through them and um kind of be able to vouch for what I'm feeling and like my own history and kind of like know the rundown now. So it's definitely not as nerve-wracking as it used to be.
Hmm. Let's talk about some of those really, really early visits, the first couple that you went to without somebody. When you arrived at the office or the location
Mhm.
and you checked in, did you know what to say?
Um, I don't even think so. I think I definitely think I do remember there was even an urgent care visit I had. This one was in college. Um, and I remember going into the urgent care with my roommate because she also had to go the same day. We were both having asthma issues. And I remember asking them like, oh, can I have an appointment? Like I just didn't even know what to say. And they're like, sure, do you have your like ID and insurance on you? And I realized I didn't because I used to not, at even at that point, like I was so used to just having them like either close by or like with my mom. So I was just like, oh my God, I don't. And I was like, can I like I
Yeah.
literally asked the woman at the front desk, I was like, can you like bill me later? And she's like, no, that's not how this works. And I was like, I need help though. And she's like, well, I don't know what to tell you. So I had literally had to text my friend who was in my dorm room because it was my birthday that day. So all
Oh my
my friends are
gosh.
in my dorm room while I'm at the urgent care. And I literally had to text him, can you find my ID and insurance card in my backpack? Take a picture of it and send it to me because I do not have it. And it was just the people at the desk, like it was a whole 20-minute ordeal, and they were definitely annoyed with me by the end of it. They're just like,
Huh.
why don't you even have like your insurance card? Like it's the bare minimum of what you need. I just like I forgot because I'm so used to like my mom having it or it being like
Yeah.
car. But I was like, I'm in California, not in Chicago right now. No one can help me right now.
Here's Gabby talking with her friends about what a crazy time she and her mom had getting an appointment for something urgent. Her mom was involved in this, but Gabby was old enough to understand what was right and wrong about how this went down.
I had a like not serious medical problem, but like one that needed to be addressed immediately because I basically had like a cyst on my back that like wasn't going away and I couldn't get an appointment with the dermatologist for like 6 months. And I went in after like 2 months and the dermatologist was like, you should have come in like immediately because this is so bad. Like you need to get this removed surgically right now. And I was like, but you wouldn't let me come in for like at least 6 months. And like all the dermatologists in the DC area, like none of them had any appointments. So I was like, I'm not sure what I was supposed to do at all.
That I have heard a million times. Gabby, did you make that appointment or did your parent or someone else?
No, it was definitely me and my mom. I don't know what I would have done if I didn't have her because it was over the summer and it was so stressful.
Mm.
Like I think we called like every single dermatologist in the area.
Yeah, and when you explained that you had an urgent problem and that it really couldn't wait, nobody gave in.
Yeah, no. I think maybe it was because like when we called all the places, we weren't talking to the doctor, we were talking to like the receptionist and
Mhm.
they never like gave my message to the actual doctor and I just don't think they like understood the urgency of it and they were like, yeah, you just can't come in until the next available appointment. Like we can't make any exceptions.
Yeah, so that's actually how it works. There's someone in the front desk or in a call center who doesn't have very much medical training at all. They're more like an admin
Mhm.
assistant, and they're answering the phone and making those decisions about who gets in and who doesn't get in. The doctor
Yeah.
plays zero role in those phone calls. They don't know that you're calling. They don't know what you're calling about. Yeah, that happens
Mhm.
a lot to people where they're sick and they need urgent kind of care, but you can't figure out how to get in.
Yeah. Yeah. I was just like in a lot of pain and
Yeah.
I like it took so long. And the doctor was like, I don't know why you didn't come earlier. And I was like, "Oh, yeah, same. I don't know why either."
Some of this almost certainly depends if you have someone associated with the healthcare field in your family. Because, like me, I'm sure many of those medical family members tend to give advice about how to navigate the system today. Maya's parents are both doctors, and she's had a consistent relationship with her primary care doctor.
I feel super comfortable. I also really know like my doctor really well. Like I've been seeing her for like my whole life. So I feel like we kind of have like a like relationship. Like she really like knows about like my life. So I would definitely like contact her if I was like worried about something or anything like that. I would definitely call her. But I do will say that I do probably talk to my mom about like health. Most of my health issues, I would probably tell her first. So it's kind of like a mixture. But if she wasn't there, I would definitely feel comfortable.
I asked almost all of the girls the same question, which was, did your family talk about health regularly? Especially what kinds of things run health-wise in the family that could impact you later? I asked because, as most of you know, this is a standard question that a provider should ask you in a checkup, because it helps them to decide what kinds of things they need to screen you for and keep watching you for as you age. Here's what the girls said. This is Maya, then Gabby, then Lena.
I feel like at the doctor's office, when like I was younger and my parents would come in, I like remember them like talking about it. And like sometimes like they'll mention things, but I feel like I've never had like a full like sit down conversation with them about like this is like very possible for you or anything like serious like that.
Yeah, I agree. I think, like, I definitely know some stuff friends in my family. I just don't think I could say explicitly all the health concerns I'm at risk for from my family, because I don't think I've had like an actual sit down conversation with them.
Lena, how about you?
I haven't had a sit down conversation with my parents about things like that, but my mom did get genetic testing to see if she had breast cancer, and she wanted to see if she had the BRCA gene, I think it is. And she doesn't. But beyond that, I don't think we've ever had a discussion. It's just like when we review family health, I just see what everybody else has.
Also, similar to what happened to my daughter, sometimes a health provider will ask you what you want to do about something. This is appropriate when they've clearly explained why it is that you have an option about something and what it means to take the action or not take the action that they're recommending. For example, I have an awful chronically painful elbow, and when I see the orthopedic surgeon from time to time, he'll explain that I could choose to have an injection to help with the symptoms, but I don't have to if I don't want to. And he explains to me exactly what the pros and cons are of both decisions. Then I, the patient, actually get to make the decision. But it is not appropriate for providers to do this when they haven't explained both sides of the decision facing the patient, or when they're asking the patient questions like, would you like a strep test today? That is literally always the provider's decision that they are supposed to make based on your symptoms and exam. And this can be an even more fraught way to do things as a provider if you have a younger, inexperienced person as your patient. Here's Jisoo on talking with the doctor about whether she should or should not have her tonsils removed.
It was kind of annoying because she was like, you can get it removed, but then like I would have to like make another appointment and like get my tonsils removed. And so yeah, it just like she kind of made it like she was like, oh, like it's fine, but you can get it removed. So I kind of like, I don't know, I feel like it implied that it wasn't completely okay.
Did she give you the choice? Like you can choose to have it removed or not have it removed?
Yeah, she did.
Did you feel like you had enough information to make that decision?
I think with the information she said about it not really causing any issues except for maybe like bad breath or getting sick a little bit more often, I try to weigh the I don't know, the benefits and costs, and I felt like I didn't want to have to go through like, you know, tonsil surgery because I know that process is kind of annoying. So yeah.
How do you know that?
From I don't know, like word of mouth, maybe.
And here's Maya and then Gabby.
Are you saying that someone has done that to you too, where they've asked you what you want?
Yeah, they're just like, oh, do you need a hearing test? And I'm like, I don't think that I'm like having trouble hearing, but like, why not do it? Like, I don't know.
Does it strike you as at all odd that they're asking you what you want?
Yeah, like I just assume that like, I think of physicals like really like by the books, like they just have to do certain tests every year. But I don't know if like I don't know if that's how it is or not. But they do ask me, and I'm always just like, I just say yes for everything that they ask, basically.
Gabby, has that happened to you? Where someone has asked you that? Oh, do you want this?
The last time I went to the doctor, they asked me if I like wanted to get my vaccines because I think I like needed to. It was like the period in between my last one was up and I needed it. And I was just also like really confused because I was like, well, if I don't get it now, I'll just have to schedule another appointment to like come back in and get it, right? So I didn't really know why they were asking me. Like, it just felt kind of convoluted almost. Like, I'm gonna have to get it at some point, and if I don't get it now, I'm gonna have to wait like 4 months.
Yeah. Did anyone explain all that to you? Like, you can do this today, or this is what would happen if not?
Wait, I don't think so. I think they were like, do you want to get this now? And I was like, well, if I don't get it now, what would happen? Like, is it just an optional thing, or is this something I need to have? And like, I don't like, it was very confusing for me too.
Most of the girls had had an experience already with health insurance, whether it was through their school insurance plan or through their parents' plan that they were still on. And the general consensus was that it was simply confusing all around. Here are Lena and Maya on just simply trying to make appointments with insurance.
Lena, it sounds like you're in the best situation because you have the full-on insurance there, so it's more seamless.
But when I do go out of network, I technically have two health insurances, and normally the UC ship isn't your primary one. Whatever your parents or your family has takes the primary, but in my case it isn't. And so whenever I go, I was trying to go see like therapy, like outside of the network, outside of CAPS is what they call it at school. They just wouldn't let me because they couldn't figure out my insurance, and I didn't know how to do it, and my mom didn't know how to do it. So I was just like, okay, I give up. And they give you like four free sessions or like under UC ship, they give you 4 sessions.
Yes.
And all the recommended ones that still are out of network but take UC ship were completely booked. So I was like, I'm not dealing with this. I don't need a therapist.
Ooh, that's bad. That's bad.
I've been seeing like a therapist like in California for like since my time here, and like navigating like insurance through that has been like really challenging. Like I remember like just this past like month, my like the person I usually see decided to like switch to private practice. And so just like navigating what it means to like be seeing someone out of network and like understanding like if you have like an HMO or like PPO plan, like I don't know, like it was just like things I like never heard of or like never been like told like what it means. So yeah, just like I feel like in that way too, like navigating insurance specifically is like really challenging.
Well, Lena had the big time vocabulary of talking about something in network. So
yeah.
So she's going to be the temporary teacher of health insurance there. No, that's very complicated. Very complicated. There is a light at the end of the tunnel here, which is that all of these girls are quickly learning the lessons they need to go forward and self-advocate in today's healthcare landscape. Barrett is a few years older than the other girls I've interviewed, and so she has a bit more experience with this. She's already learned how to speak up for herself more, but also thinks doctors' offices should be more aware of a younger adult's age.
Just in general, like, you know, I definitely feel like I've become more of an advocate for myself. And like now I do like neuro rehab for a condition I have. And now I feel like I've definitely grown because my mom, when I first started it, she would ask like, do you want me to come back there? And I even at the first like rehab session, I was like, you know, I think I'm good. And now like every time we go, I don't have her back there, and it feels kind of like nice to like be able to advocate for myself. Because like when the doctor would ask me every day, like, how are you feeling today? What's changed? Blah blah blah. Like then I'm able to tell them myself and not need to like ask my mom, how have I been feeling? Like, so what do I say? So I think if anything, I have seen, especially in the past year or two, that I've been able to be a lot better at it.
Yeah, good for you. It's really just experience. I mean, it's like you have to learn how to do it.
Yeah, exactly.
Have you ever wondered or thought, is there anything that could have been done to make the whole thing easier to learn how to do?
I feel like even just them asking, like, see if they see your age, like, especially when I was like 16, if they see that I'm 16, I feel like it would be helpful for some doctors to be like a little more understanding, or like even ask at the beginning, like, have you done this like on your own before? Like, are you used to like kind of like gauge how much you do know, make it a little less nerve-wracking, because I feel like it just felt really I felt really nervous, especially going into the first few times, like if I was, being judged, I guess, for not knowing what I thought I should have, things like that. So maybe if you see someone's like really young and you know that they're not used to this, like helping them out a little bit more, being a little more patient, I think is like definitely a huge help.
Ashley, who has been in and out of the medical system more than the others, also has already learned what it takes to just get stuff done. So you had something urgently going on. You needed to get your doctor. What did you try to do?
I just didn't even know where to begin, and I just like was like, Mom, Taylor, you guys need to fix this, because like you guys are the adults. This isn't. And then, but now, like, and I was also 16 at the time. Like, now I know what I would need to do. I would need to call their office. I have their phone number logged to my phone, and I would demand to say I need to talk to a doctor, I need to talk to someone, and I would be put on hold for a while, and then transferred, and then put on hold for a little bit longer, and then I am able to convey the message that it's not my fault that your coworker dropped the ball. You guys need to fix this.
You're so like empowered and jaded for such a young age already in the health system. Oh goodness.
I've been to a lot of doctor's appointments.
So, you're bringing up a couple of interesting things. One is that I think it's a generational thing that kids in your generation, including mine, which is the only reason I know this, don't tend to use the phone a lot.
Yes.
Like phone calls and messages are just weird, and they don't feel comfortable with that, which is funny because my generation, I'm in my 50s now, and while I'm in the middle, like I'm comfortable with technology and my chart and messaging, or I would make a phone call. But for example, my mom or my older siblings, they're more into phone calls. So that's really interesting that you were like, oh, I have to make a phone call. I realize now I have to make a phone call.
Phone calls are definitely the last resort.
And also, the girls are thinking about my favorite topic, trust. Here's Jisoo again talking about that same doctor visit about her tonsils. So my question about it is, why did you trust her?
Because I would love to believe that she's completely certified and knows everything about every issue ever.
Sure. I mean, I think I'm thinking a lot about this lately, like trust of doctors, right? So my dad was a doctor. He was born in 1925, so he was a doctor like in the old days. And back then, there was never any questioning of doctors, right? You were the doctor and you knew what was going on and you knew what was best and nobody questioned you. That's how it used to be. I think today more people feel like they're not really sure if they should trust somebody or not trust somebody. So I'm thinking a lot about how you learn to trust or not trust healthcare professionals that you see. So I'm wondering where that came from. Did your family talk to you about doctors and healthcare like ever when you were a teenager or before you left home?
I don't recall any like specific conversations about talking about medical professionals, but luckily my family didn't grow up with that many health issues. So I think we like mainly put trust in the doctor, especially for like just like smaller things and checkups where like our lives aren't on the line, you know? So
Sure, that makes sense.
I think we just always gave them the benefit of the doubt for diagnosis or anything.
And here's Ashley again. Let me ask you this about your doctors that you see now. Do you generally trust them?
I think that I have gotten to a point where I only work with doctors that I can trust because I have been spurned multiple times, and that I will refuse to be the patient of people that have spurned me or I have a consultation with and that I don't like, because I know what the effect can be of a doctor that doesn't truly listen to you.
Uh-huh. What kinds of things make you feel trusting of a doctor?
I think active listening is so incredibly important. It seems that doctors want to average you out and treat you more as a member of your generation rather than an individual. And they take your symptoms and kind of try to match it. And I feel that that just doesn't always work and can be very harmful. And I feel when I have a doctor who's making eye contact with me and is listening to what I'm saying and is not only listening, but then when I'm not speaking, adds to what I'm saying and like says, I'm hear you talk about this symptom and that makes me think about this. What do you think about that? Asking me questions and not just telling me stuff. And working alongside with me that's what makes me truly trust a doctor and feel safe with a doctor.
I really loved that all these girls were willing to talk so openly about their experiences. They know that they're in a tough spot with healthcare and the system at large. They already know that it seems overly complex, that it's hard to get appointments, that it's hard to understand insurance, that you might be confused in a visit with your own doctor. But because of all this, they also already are starting to know what they want. Trust, good communication, easier appointment making, all the things that most adults want from their healthcare providers. These girls are still young and thankfully healthy overall, but I'll argue that now is the time for them to learn more about the system that they're up against, since it's unlikely to change in a positive direction for some time, if ever. On that note, I've been working on a Healthcare 101 curriculum for young adults, and I'm going to pilot it with my own kids this summer. Okay, I haven't told them that yet, but we're going to do it. We'll meet twice a week for 10 to 20 minutes and tackle one topic each time about the system that I want them to understand better. Things like how to make an appointment, what are different kinds of appointments, knowing what you're there for so that you know what to expect and what will be asked of you. What is health insurance and how does that work? How to pay a health bill and what to do if you can't afford it. The list goes on and on. I've got 37 topics so far. If you and your young adult kid want to get in on this, email me at drpatientpodcast@gmail.com. If you have ideas of things I should add to the list, email me at drpatientpodcast@gmail.com. That's it for today. Join me next week when I'll be hanging out with Dr. Karen Leitner talking about why it is so hard to be a doctor today. And as always, thanks for listening. Thanks for listening today. To catch up on more episodes and to get new ones delivered directly to you, subscribe wherever you find your podcasts: Apple, Google, Spotify, iHeartRadio, and more. If you'd like to be a guest or have an idea for an episode, let me know at www.drpatientpodcast.com. That's drpatientpodcast.com. Here's the disclaimer. Even though I am a doctor, I'm not your doctor. These stories, my comments, and all discussion is purely reflection about what's working in the healthcare system and what isn't. Don't use any medical information that you hear in these episodes to diagnose or treat yourself. If you have a question about your health, get in touch with your doctor or local health clinic.